Most people think you should wait as long as possible before getting cataract surgery. So that used to be true, but it's not true anymore. Hi everyone, I'm Dr. Todd Driver, a board-certified cataract surgeon in Irvine, California. This is one of the most important questions I get in my office, and getting the timing right matters more than most people realize. So a cataract is when the natural lens inside your eye gets cloudy over time. So think of it like looking through a foggy windshield. Everything's still there, you just can't see it as clearly. Now, years ago, doctors used to tell patients to wait until their cataract was ripe, meaning really advanced, before doing surgery. That's because the technology wasn't as good. The procedure was harder, the recovery was longer, and honestly, it made sense to put it off. But here's what a lot of patients don't realize. Modern cataract surgery is completely different. It takes about 10 minutes. The incision is about 2.4 millimeters wide, smaller than the tip of a pen, and most people are back to their normal routine within a couple of days. So waiting until you can barely see, that's old thinking. So how do I know when it's time? In my experience, it comes down to one question. Is the cataract affecting your life? And I don't just mean reading an eye chart, I'm talking about real life. So are you struggling with night driving? Are headlights looking like starbursts? Are you having trouble reading menus or seeing your phone? Almost every patient responds by saying, I thought that was just normal aging. And sometimes it is, but a lot of the time it's actually the cataract. Now, here's where it gets interesting. Waiting too long can actually make the surgery hard. When a cataract gets really dense and really advanced, it takes more energy to remove it, which can mean more inflammation and a longer recovery. I tell my patients it's like letting a stain set into fabric. The longer you wait, the harder it is to get out. So there's actually a sweet spot, and most of the time, that sweet spot is earlier than most patients expect. When I tell my patients this, they usually look surprised. They'll usually say, but my other doctor told me to wait. And look, if your cataract is very early and it's not bothering you, there's nothing wrong with monitoring it. I'm not saying everyone needs surgery right now. But if you're noticing changes in your vision, especially at night or with glare, it's worth having the conversation sooner rather than later. And if it were up to me personally, I'd rather operate on a moderate cataract where the surgery is smooth and predictable than wait until it's so dense that we're working harder than we need to. For me, cataract surgery is routine. I've done thousands of these, but for you, it's a big moment, and I want that moment to go as smoothly as possible. So here's the bottom line. You don't have to wait until you can barely see to get cataract surgery. If your vision is affecting your daily life, it's worth talking to your surgeon. The timing matters, and earlier is usually better than later. If this was helpful, please like and subscribe, and feel free to drop any questions in the comments. I'll see you in the next video.